So there's two different gait belts, guys. Who could tell me the difference between the two?
That one's more hygienic.
Material?
Those are disposable.
Yeah, I mean,
One's black.
this is a better one, but unfortunately we're not allowed to use these. Really, we shouldn't use these because they're not as hygienic. So when you go to clean it, you can still use the stuff to clean it, but it doesn't clean as well as this vinyl one. So we clean our gait belts now after every patient. But when you put it on a person, this is so much easier to snug around them and to hold them. Okay, so I'm gonna let you guys feel the difference. So when you put the gait belt on, I call this the teeth. So you want to have the teeth facing you, okay? And so goes around their waist, comes in like this. You want to make sure everything is smooth in the back. And so if someone has had abdominal surgery, if someone has a G-tube, if there's any reason why you wouldn't put it around there, you would go and you'd put it on the chest, okay? If you have a woman who is large, she's well endowed, and her breasts sit down here, so you have a couple options. One is you can go right over the top of her breasts here, or you can just say, can you please lift up your... You don't want to do it for her. Okay? All right?
Do you use gait belts in those maiden colonies? Just curious, because that'd be awesome as well.
Yeah. It's yeah.
Well, you really must.
You want to go on a ride along with me? I could probably get a patient there if you want. So,
that's not what I wanted in my clinicals.
So you're here. So guys, so when I snug this up,
Right?
I put it through here, and then I cinch it. So now this gives me the ability to hold on to my patient, okay? So all we're gonna do is we're gonna go from the position of sitting to the position of standing, okay? And I'm gonna pretend, or he's gonna pretend that he had a stroke and it affected his right side, all right? So he's pretty flaccid. So in terms of manual muscle strength, he's a 2 out of 5 in his shoulder. He's like a 1 out of 5 in his bicep. He's a 2- out of his hip and quad. So he's really weak. This side over here, he's 4 out of 5. So he can help with one side. So when you transfer somebody, you want to transfer to their stronger side. Okay. If I had to make a guess, I would say you weigh 220. And I usually get it within 5 pounds. Where am I?
I'm like
Really?
216 to 18.
You need to go be the carny guy.
All kinds.
You have to have some kind of physical, my name's
Just drink booze all your life.
You know where they live, right? You know where a lot of the carnies live.
Off of Gibson.
Yeah.
Gibson's, yeah.
Oh yeah.
So I'm gonna have
Party town.
Kristen or Lori, one of you guys can do it. You're gonna do a sit to stand transfer. Okay, so basically it's gonna be about 100 pounds that you are gonna have to try and
You can do it.
you can do it. You can do it.
So I'm only helping with this side.
You're only helping with that side. Yep. So
It's gonna be hard.
yeah, so now this is how you come into his room. He's sitting just like that. Okay, so what's the first thing you're gonna do? Start thinking about the things you're gonna do.
Introduce yourself. Well,
Always.
I'm gonna,
You're gonna, I am whatever.
yeah, I'm gonna introduce myself.
Okay.
So then I'm gonna see if I can get him to put his weight on this side.
Yep, so you can ask him, go ahead and shift your weight and slide forward and, okay? Okay, good, all right? So now you have to think about where you're gonna, so this is where, guys, this is where you have to think about where you're gonna put your legs and your body in relation to his body and his limbs. So I would say at this point, he is gonna be at risk to fall, so I would say he's a bit impulsive too. So I would say actually shift yourself back a little bit. Okay, good. So now, there's a couple different ways to do it. One way is you can come in and you can put his leg between your legs, so now you're controlling his weak side. So he falls, I have him. You know, when I come around here, if he falls, I can hold him. So basically, you are controlling his body weight. Now I know that he can control this side, so I'm going to make him lift up with this side. So, but I still have to have good body mechanics here. Okay? So when I lift, I have to be down like this. I have to bring his load forward, and I have to almost like sit back as I stand up with him. Okay? So that's the technique that you guys wanted to sort of use.
Would it be a good or a bad idea to ask him, because he can use his left arm, right?
Yeah.
Should he be using that arm to push off?
Absolutely.
Okay, so
Yeah.
it wouldn't be a good idea to put it over your shoulder and tell him to sit. He'd probably drop on you.
Yeah, but the object of this is I want him to take off
as much as we can.
160 pounds.
So,
So okay, yeah. So now you come in and you try and
Shift your weight to the side.
perfect. Okay. Wide base. Now you don't have to do what I did. I mean I guarded this leg. It's just an occupational type thing I do, but you don't have to. You can actually do a wide base. Okay.
So I'm gonna get him to stand up
And all right. So this was good job. This was the first patient of her day. So now she says, "Man, is this what I got to do all day, every day?" Yes. So now she knows that was a little heavy. So now you have to call in one of your classmates to help you. So now you got to get him back to there.
or your tech could do that.
Or the tech.
Alright, now everybody gets a turn moving.
Dave, you want to be the tech? Go ahead.
Alright, so we're gonna do this together now?
So
From
now you
here or
can
from
do
there
it
to
together.
there?
Correct.
From the chair to the table.
Yep. And once you stand, you can walk. Once you stand, you can take a few steps.
Okay.
Yeah. It's just getting him to
Alright,
stand.
so I guess I'll probably go.
Well, you have to turn.
Yeah. So right. You can sit there. And then let's say you're right here. So now you guys can get on both sides of them. Okay.
So we want to get on both sides of his weak side,
Well, try it. See what happens.
because he's still steadying himself with that leg.
Well, so you just try what you can.
I have.
So the question is, 2 people on one side.
I would
Need a
think
leader.
yes,
How's he gonna
because he
move
wants
this
to use the stuff
not
that
Want him
he
to
can
use
use,
that
right?
leg. You don't want those in the weak.
Yeah, I started.
Huh? I mean, we're still gonna study him.
Susie, you're just gonna carry more of the load.
Okay. So what are we supposed to do?
I just feel like I'll
Point
be
a
in the
leader?
way.
Who's going to be the leader? Well, yeah, one of you.
And then you say.
The therapist. Well, who's going to be a leader between you two? Okay.
So her.
You're the leader, so then she's assisting you. You're the
So I'm just telling her what
You're
we're
telling
doing.
her
Okay.
where to go, what to do. Yeah. Yep.
Alright, so we're gonna grab him, I guess grab the weight under here, and we're gonna get him under his arms, we're gonna stand him up, I have his strong side, okay, so up, okay, I'll move around.
That's pretty good, Jason. You look just like a patient.
All right. Now, if you had any complaints or anything at all, what would be one thing you would say or could say? In terms of discomfort that you felt from them.
They weren't talking to you.
No, I don't know.
Oh yeah.
They're like, I don't know.
Yeah, I mean, if that was Josh or if that was me, and you know, we did that, and I mean, I'm like this here.
Yeah,
I mean,
that's
my force can be where I can squeeze a hold and give my patient a contusion, or I can lift and really hurt their shoulder. So, you know, you got to be careful and where you put your. So try that again. Go back there and get in the same position you guys were. Okay. And so now
So we don't
Lifting from the belt.
you have to have your hand on the belt. You have to have at least one hand on the belt, and you want to have your right hand right there. Yes. So now there's a couple different options. You could put your other hand here. You could do what Susie does, which is what I would do. I would put my hand on the belt, both sides. And then you ask your patient to push up. So you know he can push up with his strong side.
So we're not holding it all, just on the gate belt.
Just from the belt.
Just a gait belt.
Okay, stand up on the strong side.
And back down, and back down, and back down. Yep.
Yeah,
So now, if you could take that off real quick.
Yeah, that feels really, is it supposed to be that
It actually
tight?
doesn't hurt though. I thought it would actually feel weird, but
You can give me that one here. So
Ooh, that
now,
one's gonna hurt.
so now this one here. So this is the other belt. And as a therapist, when I put this on,
That's still deep.
so as a therapist, when I put, you mean like left hand and right hand, or do you mean backwards?
Oh, I just thought that this part would be on the inside. That doesn't matter?
No. I mean, you know, whatever works. So basically it's like this. I tighten this up. So now it's on, it's snug. Now you guys try it. It moves more. These vinyl belts don't hug the skin or the body the same as the canvas ones. So they're not as
like
good.
the fabric catches
Yeah.
versus this
Over
one
the right
slides.
leg, and then
Okay.
to the chair.
So it's usually easier. It's usually easy. You don't. It's usually easier for a patient to go from here to standing because he only has to stand up this much, than to go from the low position of here all the way up.
So you're gonna try it this way then?
Okay, so you guys feel? Okay, so Greg.
Muscles.
There's your challenge. You have to.
Wait it.
He is 80. He has some arthritis in his body. He could help a little bit, but he has skin that's frail, so you don't want to tear his skin. And he has 2 artificial knees that are they're old. They're about 10 years old. So that's your patient. That's what you're dealing with. So his advanced age of 80, some arthritis in his shoulders and arms, and he has 2 knee replacements. Wow. You have to get him from there back. He is his body weight, so he can do what's called minimal assist. So minimal assist means he can only assist 25%. You have to take over 75%. So you are going to basically have to lift him. But I mean, you can help a
Now
little
we
bit.
would have it be closer though, right? He would probably park his wheelchair right next
Yeah,
to
you
the
can say
bed.
that. Yeah, exactly. Yeah. So he would be close to the surface that he has to go to. So this is where you definitely have to use good body mechanics, quads, back, and basically you just have to stand up. And then the hard part is not going to be standing. So when you turn, don't. So you have to hold them and pivot, and then sit. Yeah, guys, this is the kind of job where you are close to your patients. There's skin to skin contact. I mean, there's bad breath you're gonna smell, and it's just just how it is. What's that? I thought I heard something.
Okay, then me
Nothing that
and
wants
Susie
to
and I were
be-
having a side chat.
Oh, okay.
Yeah, Dr.
Sorry.
Z distracted us.
His long locks.
Okay, yeah.
Oh.
Okay, let's get all over.
All right.
Said what's up with that? Yeah.
So now Greg is here. So basically his body's here. So he wants to be as close as he can. So he's gonna take a step over. There you go. Good. And widen your base. And what I would do is I would bring your right foot inside his left. Yep. Yep, because remember, this is his strong side. And so now you will, now he
I thought this was hard.
Wait, that's
yes. All right, no, yeah, he doesn't actually have a strong side, so he has two of them.
There's two sides. That's right. Squat. We're scaring
You can help a little bit with your arms, a little bit.
He's not helping.
He's just not.
Because
His arms were down.
So this is a good exercise because now Greg's the therapist who worked with him and Regina or Danielle. You guys have him. He's your patient the next day. You read his note. He said patient transferred. Sit from chair to bed. Max assist of 1. That means it was maximal assistance of 1 person. He's the 1 person. He did 75% of the lift. He did 25%.
There's no way.
So now you come in and you try and do the same thing.
No way.
Yep.
Right now?
Right now.
Bye.
Right now.
Or tomorrow?
When we're going down.
Well, you got to get the same resistance.
I will. I'll do the same thing.
You don't know what's not going to happen. You don't know. It might. You might.
Alright, so I'm just putting
That's it. But you got to plan it out. You have to get close. You have to get in tight.
Didn't you say leg around?
Well, you don't have to do that because it's not a stroke deal. So it's just weakness. He has 2 knee replacements. But the whole thing is you have to get in, get down, and lift. So whether this is a box or a person, the technique's the same.
Got this. And he literally is not helping at all.
No, he's helping. He's helping. He can push up. He can push up. But now here's what you tell your patient. Get in position. You tell your patient, lean forward. So now he gets his body weight forward. Now Greg didn't necessarily have to do this because he was strong enough to physically handle the person. Now he could have done it.
He kind of did. Like
He
pulled
did
me
it
into
naturally.
that.
Yeah, right. So now, but you have to tell him.
Okay, slightly move into
Your feet
me.
have to go wider
There we
and
go.
go the other way.
That makes more sense.
Down. Well, in tight. Head up. Now you're in position for maximal lift. Okay, so when you're ready.
Holy shit.
I helped.
The only thing you didn't do, you did everything perfect. The only thing you didn't do is at the end, you didn't make your turn. Because I didn't want you to hurt your knee. Everything else is perfect. One more time. You pick one of your classmates.
Vagina.
Yeah.
I used to call that all the time. No. Please don't call me that. Can we just like forget that?
You're gonna get to,
You know I'll embarrass you.
after you do this, you get to pick one other person, and then what?
I'm sweating.
Okay.
What's hard? It's hard work. This is my point. Doing transfers.
So go ahead and lean into me.
We need a weightlifting class before then.
Hang on. Number 1, you gotta put shoes on. You cannot do this.
Proper body mechanics.
Your days
Yeah.
of not wearing shoes are over.
Professional.
I'm walking in the clinic like that.
Don't walk in. Yeah.
I'm walking in the clinic like that.
Oh god.
And
This
then
is
you
the
get to
fun.
pick one other person after this. Okay.
Go ahead and lean into me.
Okay. You get yourself ready. Then you can say on 3. You can say 1. You control.
Okay, so on the count of 3, we're gonna move you over to the bed, okay? 1, 2, and 3.
So what that's called is a half squat. So basically, Regina wasn't strong enough, and it's okay, wasn't strong enough to get his body weight from this position here all the way up. Where Greg, he stood him up, then turned him, and sat. And that's just a difference of strength. That's all that is. Pick one other person. One more time, last time for you.
Kevin.
Kevin, okay.
Cat dog.
Give me 25. You want to need to. The question is, if this is a wheelchair, would you need to have somebody stand behind and hold the wheelchair?
You just lock
The
it.
answer is no. You just lock the wheelchair, and then the wheelchair is not going to move while the person is doing the transfer. So basically, what I'm getting at, a max assist of one person should be literally one person. But there's going to be times, like in Regina's case, where you go, if I do that again, I'm going to get another person to help me. Okay, and that's okay. Go ahead, Kevin.
All right. Count to three. After three, we're just gonna stand. Count 1, 2, 3. 1, 2, 3. Yes.
So all he did was make one extra step for himself. Do it one more time, and this time put your right leg in first. And now when you do it, yep.
1, 2, 3. Stand.
And then turn. Now he only has All right, guys. So if you guys have the idea of body mechanics, okay, we're going to go into bed mobility, transfers, all this stuff in much greater detail over the next couple of lectures and labs. Next time we're going to do draping as well. Okay? Thursday we're going to do all that. I'll have Dr. King with me, so she'll help. Okay?
Sweet.
All right, guys. If you guys could, please try.